So we're here today at the Glaucoma Patient Summit in Long Beach, California, and joining me is...
I'm Dr. David Richardson. I'm in private practice just south of Pasadena, California. My presentation today is essentially an introduction of what glaucoma is in a manner that will allow me to describe the modern medical treatment for glaucoma. It's kind of a survey from the early treatment all the way up to the latest FDA-approved therapies, which is as recently as last year.
What are some challenges that glaucoma patients commonly face in their treatment journey? And are there any specific strategies you implement?
The main challenges are just using the medications. Most patients are familiar with taking oral medications. You take a sip of water, it's a pill, it's pretty straightforward. But with eye drops, there's the challenge of really aiming, learning how to use them, knowing whether they're in the eye. This can be a problem also with our older patients who have arthritis or maybe with diabetes, some neuropathy. So there's the challenge of getting the drop in. Then even before getting the drop in, there's the challenge of getting the drop. Many of the newer drops and the more effective drops, or the drops that don't have to be used as often, are simply not covered by insurance. And so cost is a factor there. The other issue is wastage. I was talking earlier about getting the drops in the eye. Well, if you're having difficulty doing that, it's quite common that you're going to end up using 2, 3, even 4 drops, and you can run out of your medication before the end of the month. And then that can be a problem in terms of getting authorization from the insurance to actually give you another bottle. There are some newer laws here in California that allow pharmacists to give you a window during which, even if the month isn't up, you can get your next bottle. But that can be a real issue. Fortunately, there are some vendors here today who actually have developed some rather innovative solutions for that problem. And then, the other is just dosing. Fortunately, we have some very good drops that work just once a day, but we have other classes that require really 3 times a day. And that's very, very difficult to get something in your eyes 3 times a day. Because in the middle of the day, we're always busy doing something. It's one thing to actually, have a medication, whether it's a pill or a drop that you use just in the morning, just in the evening, because we all wake up and we all go to bed, generally. But middle of the day, we could be anywhere. So those are really the biggest challenges that I see in terms of utilizing the glaucoma medications.
And are there any strategies you rely on when patients explain that they might be having difficulty with compliance or?
Absolutely. When it comes to compliance or adherence to a set schedule, there are a number of great options. Easy ones include just thinking about what it is that you do every day during the time that you need to take your drops. Right, so we all get up in the morning, there are things in our morning routine. So if we just kind of attach the glaucoma drop usage to that habit, could be brushing your teeth, washing your face. You don't necessarily need to rubber band the bottle to your toothbrush, but the idea is that you would get into a new habit based on your old habits. Same kind of thing for nighttime dosing. The problem with when we say bedtime dosing for many of the glaucoma medications, primarily the prostaglandin analogs, but now also the new prostaglandin agonist, is that you say bedtime. Well, although we all go to bed every night, we don't always do so at the same time. Some of us end up watching TV, falling asleep, or reading and falling asleep. And so it's important that the evening dosing be tied to something other than right before you fall asleep. Otherwise, you risk missing it if you've fallen asleep before taking it.
And on that topic, what does happen if someone misses their dosage at bedtime?
So one of the downsides of medical treatment of glaucoma versus surgical treatment is that if you miss a dose, the pressure is going to go back up. So it's just like holding a ball underwater. If you take your hand off the ball's going to rise right back up to the surface. So if you miss an eye drop, then you'll end up with elevation in pressure. And one of the issues that we now worry about is not just the average pressure. We know that as the average pressure rises, the risk of damage from glaucoma increases. But there's now mounting evidence that fluctuating pressure can actually be damaging to the optic nerve. So missing that dose results in greater fluctuation. Now there are some medications that are a lot more forgiving than others. For example, the prostaglandin analog class is very forgiving. I have patients of mine who have the either the Reichert 7CR or the iCare Home 2, and they're able to test their own pressures at home. Some of my patients have noticed that they can go 48 hours without redosing their prostaglandin analog. That's not something that I would recommend people do unless they have access to home tonometry, in which case you can really see, well, this is stable for me. Okay, fine. Then every other night, cuts down on the cost if you can keep that routine up. But for most people, what they need to know is that this class is forgiving. So if they miss a dose, not to stress out about it, not to beat themselves up, just take it the next day. And with the prostaglandin analogs, they do not have to be taken at night. So if you forget it the night before, you remember the morning of, it's not necessary to wait until that night to use it. They can go ahead and just take it immediately upon awakening. And so the certain classes like the prostaglandin analogs, very forgiving. Other classes not forgiving at all. So when it comes to the carbonic anhydrase inhibitors or the alpha agonists, missing a dose, the pressure will go up. Many are dosed twice a day. I generally try to have my patients use those two classes 3 times a day, and the reason is twofold. One is that if you actually look at what we call the peak and trough, once every 12 hours, you do start to lose some effect before you take the next dose. So then if you miss that dose, you've lost all effect by the next time you dose it. If, on the other hand, you take it 3 times a day and you miss one of those doses, you've not lost all of the effect. So you've got a little bit more flexibility there, and you can worry a little bit less about what's going to happen to your pressure.
Can you discuss the importance of patient education and empowerment in glaucoma management?
Oh, I mean, it's so important for so many reasons. I mean, I think that patient education, empowerment is really critical for any condition. But there are some conditions where you can probably get away without really educating because people are already aware. The problem with glaucoma is that, one, most people have no idea what it is. And even those who are peripherally aware only know that, oh, family member had it, lost vision. But it's a condition that's asymptomatic, right? So the problem with any kind of condition that does not have symptoms is that there's no bodily awareness, right? So you combine no bodily awareness with no kind of cultural awareness, you have something that's quite mysterious. And it turns out glaucoma is a pretty mysterious disease, even to physicians, right? I mean, we know how to treat it. We're still learning about how it works, like what happens in glaucoma. Why does a high pressure cause damage to the optic nerve? We don't have a really fully fleshed out answer to that. So it's important when you have a condition that has no symptoms to really make certain that the individual who's going to have to be using these drops multiple times a day, it's inconvenient, it's expensive, all of these kind of things, they come with side effects often. You really need to make sure that that individual understands what the condition is, what the risks are, what's going to happen if they don't use these drops or these medications. I know that early on in my career, when I was still learning how to communicate and communicate with and educate my patients, it was surprising to me that sometimes patients would come back and we'd say, okay, well, what drops are you taking? Oh, I'm not taking any drops. Well, I prescribed these drops to you. Oh yes, I finished the bottle. So, just simple things like that. This is a chronic condition that if you can't just treat it with one bottle and then it's gone. This is a condition that's very likely going to be with you for life. We need to treat it for life. You know, one of the challenges in most modern practices is that there's just not enough time for the physician to really sit down and have a face-to-face conversation, go over all of these. And that's where we really depend on having great resources, such as, you know, the resources the Glaucoma Research Foundation provides. You know, the introductory booklet about glaucoma is fantastic. It's balanced. It's I think detailed just enough so it's not overwhelming, and it's also empowering rather than, you know, being. One of the things I always fear is that someone's going to go immediately to the internet, and the problem with the internet is that you know, they could land on a site that is going to give them great anxiety and great fear, and that's going to be the opposite of empowerment. And so, you know, it's important to have a solid, reliable source of education. It's also important that patients who have a newly diagnosed condition are given the opportunity to feel they really can do something about it and not overwhelmed, because any chronic condition can be very stressful, and especially when you've got one that could potentially result in blindness, which is one of the things that people fear more than anything else. Right?
Why do you think it's important for glaucoma patients to attend events such as the Glaucoma Patient Summit?
Oh, well, events. I mean, there really aren't other events besides the Glaucoma Summit. This is a very unique conference to be at. I mean, most conferences that I attend are very much geared toward physicians. You know, to have a summit that is geared specifically for the needs of the patient is unique and empowering. It's something that I wish there was more of. But you know, fortunately for those who can't make it physically to this, I understand much of the content will be put online, which is fantastic. I mean, the opportunity to have information presented in a manner that is appropriate for the kind of level of understanding, for the experience of the individual with glaucoma, is incredibly important. But also the incorporation of those with glaucoma sharing their experiences, those who are family members or care partners of those with glaucoma sharing their experiences, having industry here with devices that can assist with both the managing of glaucoma, the monitoring of glaucoma, just learning what there is out there, all of these things, and having it all in one place in one weekend is really incredibly valuable. And then the other thing, something that we've all missed over the last few years with COVID-19, is having the ability to interact with others who, you know, have the same condition and speak with them about their experiences, learn from them what worked, what didn't. These are all things that are very difficult to get in any other kind of situation or environment.
Right. I think it must be interesting to patients to see their doctors or other doctors in a different setting, in a presenter setting.
Right.
They might have more time to answer their questions, per se.
Yes, and having the ability of the audience to ask questions after the talks. Many times there will be individuals who will ask a question that half a dozen or a dozen other people in the audience wanted to know the answer to that, or, you know, perhaps just were too shy to raise their hands. So it really is an opportunity to learn a lot about one's condition, and also to have that sense of shared community is really, really important, because, you know, we all deal with our medical conditions alone, right? Nobody else is, I mean, you're treating your condition. Yes, other people have that same condition, but they're dealing with their condition while you're dealing with yours. It can be very, very lonely and isolating to have any, you know, medical disease or condition. So to have an opportunity to physically share in an environment with others who are both experiencing that and treating it is really unique.
Well, thank you, Dr. David Richardson, for joining us today and for sharing your incredible insight on glaucoma and glaucoma care.
It's been my pleasure.